Hi, my name's Erin Safe and I'm about to conduct an exercise program for a 40-year-old male. His goal is to increase his stamina so he can rejoin his local football team. He's not played for 6 months because he sprained his ACL in his knee, and his physiotherapist has referred him to myself so he can undertake an endurance exercise program. We'll be using mainly body weight exercises and also using free weights. So, hi Christian, how are you?
Good, yourself?
Yeah, good, thank you. So we're just going to take you through your exercise program that we've put together for you. As we identified in your pre-screening questionnaire and also referred by your physiotherapist, we'll be doing an endurance program. Before we start, you'll need to do a warm-up. Warm-ups are very important before you do any exercise program, as they help basically get your body prepared and letting your body know that you're going to be doing some exercise, so that can help prevent any injury. So you can use any of the cardio equipment. You can use the bike, the treadmill, the cross trainer, anything that you feel most comfortable with, and basically that you enjoy doing. That's the most important thing. So the warm-up should go for around about 10 minutes. And what you want to do in that warm-up is basically start at around 40% of your maximal heart rate, so around your sort of resting heart rate, and slowly build up to about 70%, because that's what we're going to be working at during your program. You want to do that slowly. Once you get to that 70%, you need to maintain that through the rest of the 10 minutes. When you're doing it, you'll notice that your heart rate will speed up, your breathing will get a little bit faster, you should start to get a little bit of a sweat and a little bit puffed, which is exactly what we want. So the exercises that we're going to be going through today in your program, we've got a squat, a lunge, a bent over row, a push-up, a bicep curl, a tricep extension and a crunch. Now with those exercises, we'll be doing 3 sets of each exercise. We'll be doing 20 repetitions, and you'll be getting a 30-second rest in between each set. So we'll go through the first exercise first, which is the squat. Now to do a squat, you want to have your legs, your feet around about shoulder length apart, slightly wider. Toes facing forward but slightly out. You're basically wanting to, it's like you're going to sit back on a chair. So you want your weight to go through the back of your feet, through your heels. You want to have your abdomen braced, a neutral spine, chin in, looking forward. You can have your hands wherever you want. You can have them out the front, you can have them on the hips, whatever's most comfortable for you. And you want to go down as low as you can without getting any pain, but while keeping your form. So the goal is to get around 90 degrees, and then just push back up through your heels. Now you just need to be careful with your knee, so don't go too far to start with, just go as far as you're comfortable, but maintain that form. So you're just going down like that. So if you want to have a go, and I'll just make sure, just check your technique. So make sure your feet are shoulder width apart. Yep. Okay, let's go. Excellent. How's that feeling in the knees, okay?
Yeah, that's fine.
Yeah. Great. So while you're doing the squat, you're working your glutes, your hamstrings, your quads, and also your calves. Great. Okay, so the next exercise we're going to be doing is the lunge. Now, lunge is also called a split squat. So legs split. Now, you want your toe up at the back, flat foot on the front, and you're pushing through that back foot. So again, you have your knees tracing your toes, so you don't want that knee to go past your toe. Now you to start off with, just come down into that proposal position. Again, you can have your hands out the front, you can have your hands on your hips, whatever's comfortable. And then you come up, and then it's just going down, up and down, making sure you can still see your toes, and you're pushing through that back leg. And you're going to be doing 20 on each leg for three 3 sets of each,
Right.
with a 30-second rest. So I'll get you to have a go for me. So just get that initial starting position. Excellent. And again, this is working your glutes, your quads, hamstrings, and your calves. How's that feeling with your knee, okay?
Yeah, that's fine.
Yep. As soon as you start to feel any pain, I want you to stop and let me know. Excellent, making sure that abdomen is braced. Great. Okay. Now the next exercise is the bent over row. So we'll be using our weights for this. So you want to be using around about 60% intensity for your weights. Now with this, again, feet shoulder width apart, braced abdomen, neutral spine, shoulders back and down, chin in, facing forward. Now to start off with, we have our hands in front. We're bending over, still having a nice straight back. So just sticking your bum out, and you're just rowing straight up to your chest, and you'll be feeling that in your scapula. So you want to be pulling those shoulder blades together, squeezing them together. So if you want to have a go. That's it, good. So squeezing right through there. Excellent. Good. That's really good. That's feeling okay?
Yep.
Yep. So with that one, we're using our lats, our traps, and also our biceps. Okay, we'll move on to the next one, which is our push-up. So with the push-up, you can either go on your knees or your toes. We have our hands again under our shoulders, so just slightly wider than shoulder width apart. Now imagine that there's a triangle. The tip of the triangle is where you want to be looking. And you need to pretend, basically think of your body as a plank, and you want to be moving that down as one whole piece. So you want to brace your abdomen so that you're not using your back, and you're just going straight down to the floor and pushing straight back up. So straight down and up. So if you want to have a go of that. So choose whether you want to use your knees or your toes. Good. That's it, making sure your hips are up. Fantastic. Now with this exercise, you're using your pectoralis major, so your chest muscles. You're also using your deltoids and your triceps. How's that feeling, okay?
Yeah, good.
Excellent. Okay. So the next exercise we're doing will be bicep curls. So just remember, again with that one, 3 sets of 20. Make sure you have your 30-second rest in between, as all the other exercises beforehand. So this one we're doing bicep curls. So obviously this is working your biceps, so this muscle in here. Shoulder width apart with your feet. You can also do a split stance if that's more comfortable. Braced abdomen, neutral spine. Shoulders back, palms facing out, and you want to keep your elbows in close to your waist, and you're just lifting up and down, making sure you're getting that full range of motion. And you want to make sure you do it nice and slowly. If you need to have a little pause at the bottom, make sure you do that so that you're not getting that momentum going, because you start to use your back and you'll injure yourself. So I'll get you to have a go of that one. Great. Excellent. That one's feeling okay.
Yep.
Now with the weights that you're using, you want to use again 60% intensity. Fantastic. I'll get you just to place those down on the ground. The next one we're doing is the tricep extension, so we'll just be using one weight. Now just be mindful when you're putting it up over your head that you go around so you don't knock yourself out. You want to keep your elbows nice and close into the head, and similar stance as what we've done in all the other exercises, shoulder width apart, nice neutral spine, brace your abdomen, and you're just putting that weight straight down and lifting it straight back up. So almost like you're trying to scratch your back with the weight. And you'll be working your triceps in that one, which is the back of the arm. I'll get you to give that one a go. And again, we'll be doing 3 sets of 20. Fantastic, that felt okay. Get you to place that one down on the ground. Now the last exercise we'll be doing is the crunch. So down on the mat for this one. Now the most important thing for this is that you have your back flat on the ground. The best way I find to do that is to have your legs up in the air. So you want to brace your abdomen. You can have your hands across your chest, you can have them by your sides, you can have them beside your ears. Just be careful not to put them behind your neck, because you'll notice that people will have a tendency to pull and you don't want to be using your neck. So I'm going to have them across my chest. Now it's just a small movement. You're just lifting your shoulders up off the ground. As soon as you feel your abs engage, that's as far as you go. And then it's just back down. So I'll get you to pop down and have a go. Now this is working your rectus abdominis, which is your six-pack muscles. It's also working your internal and external obliques. So make sure you engage those abs. Good. Is that feeling okay?
Yeah.
Now, if you get any back pain or neck pain, I just want you to let me know. Fantastic. Okay, so there are all the exercises. Did they seem okay?
Yeah.
Yes? Excellent. Okay. So the last phase of the program is the cool down. Just as important as the warm up. Basically just needing to slowly get your body back to resting position. So again, you can go on the bike, the treadmill, the cross trainer, starting at that 70% and slowly going back down to your 40% of your maximal heart rate. And basically you need to do that just to stop blood pooling, you know, so you don't pass out basically. And then, so that goes for about 10 minutes. It also helps prevent the buildup of lactic acid. After that, do some stretching, some flexibility exercises. So we can do our quads, if you want to just have a go. Another one we can do is our calves. So just pushing that toe back, lifting your back heel. We worked our triceps. And also shoulders. Excellent. Okay, so that gives you a bit of an idea on what to do. Now, I'm just going to ask you a couple of questions about the program, if that's okay.
Yep.
Were you satisfied with the program that we've put together for you?
Yes.
Yes. Now, the aims and objectives that were stated in your pre-screening questionnaire, did we meet those?
Yes.
Yes?
Yep.
And you enjoyed the program?
Yes.
Yes. So it suited your needs and you're happy with your performance of the exercises?
Yeah.
Yeah. Any questions at all? Is there anything that you might like in the program that we haven't put in?
No, seems all covered.
Yep. Okay, great. Excellent. All right. Well, thanks very much, Christian.
Thank you.
That's okay.